The Greater Manchester Wellbeing Toolkit was co-designed with colleagues from across the Greater Manchester system. It is packed with practical tools and guidance to help you to look after yourself and support those around you as a peer, team leader or line manager. The toolkit also offers an opportunity to practice having good conversations, as well as delivers a series of insight into sessions across different themes that have been flagged up, such as hybrid working, menopause, LGBTQ health inequalities, musculoskeletal and mindfulness. In this short video, we will be exploring menopause awareness, giving insight into symptoms and how it affects women in the workplace, and how we can support colleagues and line managers to start the conversations and signpost to the help that is available. Menopause. It's always been around. Today, on average, women reach menopause at around 51 years old, and many women work until their late 60s. Around 3.5 million women aged over 51 years are currently employed in the UK. 8 out of 10 menopausal women are in work. This is a stage in every woman's life. It's not always an easy transition. 3 out of 4 women have menopausal symptoms. 1 in 4 have serious symptoms. How does this affect women in work? The most common symptoms are poor concentration, brain fog, tiredness, feeling low, depressed, low confidence, and hot flushes. 45% said menopausal symptoms have a negative impact on work. 47% who have needed to take time off due to menopausal symptoms said they would not tell their employer. 1 in 4 women consider leaving work because of menopause. Imagine if we lost a quarter of our female workforce aged 40 to 60, what would that do? By talking about it more openly, no more taboo, and with the right help and support, we can improve that. And it's not just something women need to know about, everyone does. Whether it's you personally, if you're supporting your partner, friend, family member, work colleague, or if you're a line manager. Menopause is a stage in every woman's life, and usually defined as when a woman has not had a period for 12 months. The following day is classed as menopause. Perimenopause is the time leading up to menopause, when a woman may start to notice some changes. Postmenopause is the time after menopause. When we talk about menopausal women, we mean those in perimenopause or postmenopause. Menopause age usually happens between 40 to 55, but can occur up to mid-60s. It can also occur earlier. Naturally, 5 in 100 women menopause between 40 to 45. And in Britain, 110,000 women aged between 12 to 40 are affected by premature ovarian insufficiency. Menopause can also happen early due to surgery such as hysterectomy and certain types of cancer treatments such as chemotherapy. Our hormone levels change throughout our lives. The main ones which have an impact on menopause are estrogen, progesterone, and testosterone. Estrogen nourishes the tissues of the body, regulates bone turnover and cholesterol, as well as keeping the liver and heart healthy. Progesterone boosts feelings of calmness, aids sleep, and can help improve mood with blood sugar levels. Testosterone increases motivation and optimism, helps women to feel brighter and more assertive, increases bone density, and boosts sex drive. During menopause, these hormones can be out of balance. Estrogen levels fluctuate and progesterone levels decline, which is when a woman may start to notice symptoms. Symptoms of menopause can vary from person to person. There are a wide range from physical to psychological, such as low mood, brain fog, hot flushes, fatigue, itchy skin, poor sleep, and anxiety. Every woman is different. and some don't experience any major changes at all. Others will notice some symptoms, and 1 in 4 will experience serious symptoms. Symptoms, on average, last 4 to 8 years. Symptoms can be managed in several ways. A woman may choose to go to their GP or medical practitioner, who will use the NICE guidelines to determine the treatments they will be able to offer. This includes hormone replacement therapy, HRT, which can be administered by tablet, patch, or gel. A GP can advise on the safety and effectiveness of HRT, if it's a good idea. Go along prepared with a history of your menstrual cycle and symptoms and for how long. Others choose a more natural approach to using complementary therapies or herbal therapies, including St. John's wort, red clover, and milk thistle. Always choose a qualified herbalist or nutritional therapist for advice. Lifestyle changes can be beneficial, both during and post-menopause. Introducing a healthier diet, quitting smoking, reducing alcohol, taking up some kind of physical activity, and introducing vitamins such as calcium and vitamin D may be helpful to mitigate some symptoms. Post-menopause health is important too. It's not just about things during the transition. Consider things like osteoporosis, cholesterol, and heart disease. A GP can advise on this too. The most important thing is to understand what menopause is and choosing the right approach for you, managing symptoms and your longer-term health. Women struggling with menopausal symptoms should not feel afraid to reach out for help and support from medical practitioners, family, friends, work colleagues, wellbeing champions, line managers, and HR. Ask about menopause guidance or policy within your organisation. The Greater Manchester Health and Wellbeing Toolkit is packed with helpful resources and information about menopause. It's important for everyone to talk openly about menopause. It isn't only about women, it's about everyone. Let's talk about menopause.